Alison, it's lovely to see you properly.
Thank you.
Because I keep seeing you on your lovely Facebook posts, and we're part of an amazing community.
Yes.
So it's lovely to actually meet you properly.
Yes, Stephen kept saying to me, "Oh, you've got to add Catherine. You've got to add Catherine. She's very similar to you." And I was like, "Oh, really?" And obviously knowing that his Catherine? Yeah, has got EDS and issues. It's kind of like, as they say, you attract, don't you, like for like kind of thing. Yeah, he said, obviously, so I had a kind of nosy and downloaded your book, and just generally getting to sort of see what what you're about, and looking up what you've been through. So it's very, very similar story. I do feel though that you're probably a lot more advanced along the journey than I am, but yeah.
I don't think it's a journey that you want to be advanced in. I mean, God, I left school at 12, and if somebody said to me then, what would you like to get qualified in? I don't think either you or I would have said, we want to become highly qualified and trying to stay alive, not be in survival the whole time.
Yeah, I don't think being broken's quite a good qualification, is it?
No, it's not. No.
It's bizarre, isn't it? Because I mean, a lot of my illness that I had as a child, I didn't understand it until more recently. I knew as a child I had a bowel condition, and I knew that, I didn't realize the effect it had on my eating habits when I was younger. To the point where my mum wouldn't let me eat anything that my sister and they could eat. And I always thought it was just because she hated me. I didn't realize at the time it was because I had a bowel condition, and it was what was making me so poorly. Had she explained it to me, I probably wouldn't have run away as a teenager and been, quite so catastrophically blinded as I was in sort of the way I felt about what my parents felt about me.
Yeah.
So definitely having disabilities and illnesses definitely has an impact on you, especially if you've dealt with it your whole life.
Yeah. I think, I'm kind of stopping just to pay respect to, in a way, what you've just said, because I think there are so many young teenagers out there who either do have an averagely good parent who's trying their best but doesn't communicate, or perhaps parents who've just got too frightened by the condition. I mean, I had a mother that was too ashamed to admit that I was ill, partly because I think she was ill and didn't understand it, and then partly because socially it was too terrifying because it meant she'd failed, and she already felt she'd failed. So, but you have to become an adult before you can untangle and unravel all of that stuff. So
absolutely,
I think the work that I do, I mean, that's why I call it unraveling. It's unraveling all the entanglements, because you have the conditions which very often are not diagnosed properly, they're not understood properly, you don't really get help, but then you get all the, what I call the add-ons. You get the financial difficulties, and you get the career difficulties, and you get the friendships and the relationships, and where do you live, and have you got the 3 years of accounts, and it becomes an absolute minefield. And then people around you on average will be saying, what are you doing for Easter, what are you doing for Christmas, and you're going, Easter? Is it Easter? I don't know, it's Easter. It's a real phenomena, so
I think for me the worst bit was the fact that my mum shunned having a child with an illness, and she was very much for my sister and not me. But as an adult, and understanding what I do now about my illnesses and disabilities makes a lot of sense to what I went through as a child, and why I was always in so much constant pain, why I struggled with what I did, and why I always felt like I wasn't normal, because I'd see other people going about that, every day and being you know, great. They could walk for miles and they were walking hand in hand with people. And there was me who struggled to walk about 2 minutes and, and I was in so much pain. Or my bowel was so bad that I would end up, I mean, I was diagnosed with an underactive colon that I obviously didn't know about until I fell pregnant with my son in 1996 and started bleeding. And I was diagnosed with ulcerative colitis. And I knew I'd had a bowel condition my whole life. I just didn't understand what it was. And the hospitals and doctors failing me right up until 2017, when they finally had to do an ileostomy because my colitis was so bad. And I'd been put on steroids for 14 years, which is why I'm now riddled with arthritis, why my spine's collapsing, and why I'm now a diabetic. Because they wouldn't do the stoma surgery, because all they kept saying to me was, you're not bad enough. They didn't know me. They didn't know my life. They didn't know how much pain I was in. No matter how much you try and articulate it at an appointment, they don't believe you. They don't want to believe you. You're just another quick 10-minute appointment that they need to get out the door.
Yep. Yep. Yeah. Yes.
I think that's why I advocated so much for my children. When my son started, so he was, I think, around 2, and I was like, right, he's never had a solid nappy. No, it's just toddler diarrhea. No, it's been like that since he was a baby. And finally, at 3.5, he was taken into Great Ormond Street, and they diagnosed him with basically the same condition I had, an overactive colon, food allergies, and what they call non-specific colitis. So stress, allergies, that kind of thing would flare it up. And he was still having accidents right up until he was 8 years of age. You know, he still struggles now. And I think the worst part is the fact that you're made to feel like you're making it all up. You're just you're just one of those parents that just is overcompensating, or just, you know, worrying too much about a silly little thing. And, you know, that's why I ended up doing what I did. And I advocated for all 3 of my children with their illnesses and disabilities, because I've been there. I knew what to look for. I knew what was going on. And also, I'm a stubborn moo, and I wouldn't take no for an answer.
Yeah. But they need that.
Mm.
If you and I had had that,
Yes.
you know, I always think that well, I'm so comforted in a way by the job that I do, because I can hear people. You know, I can even see if someone can walk. I can see someone even walking to me, and I know something's up. And, you know, that's an incredible gift that's come out of all of this. So I'm grateful that your 3 children had you.
Yes. Yeah. I mean, they're doing amazing with their lives now. My youngest is suffering a lot at the minute with her health, but again, it's, you know, it's kind of being that advocate, and not letting the specialists and consultants, who 9 times out of 10 just read from a textbook. You know, the amount of GP appointments I've been to, and they'll be like, oh, let me just look that up in a book.
Yeah.
I could probably tell them more about the condition than they know, and they're the doctor.
Yeah.
It just, you know, it's just a very strange world we live in when it comes to how they are now compared to what we know ourselves living with the condition.
Yeah, and I think I mean, I very rarely get into this subject, but I am going to say it out of respect for both you and I, really. I think Western medicine has a lot to offer.
Mm-hmm.
But what I've noticed during the time that I've been a patient is that too many consultants, specialists, doctors, nurses, they're under too much pressure, which is affecting the ways in which we're treated. But I think, secondly, I think they're too reliant now on machines. So that sort of gut instinct that I've been trained absolutely beautifully, but clinical experience teaches you to have a gut instinct. And I think if I had machines that I was made to rely on, that just did all of it for me, I wouldn't have developed that gut instinct. And, you know, there have been a couple of, no, I've been really privileged in some respects, because I have over the years had just enough real human beings, as I call them, that have just taken one look at me and gone, you're in pain all the time, aren't you? And I've just known that it was safe to say yes, instead of, you know, being treated so appallingly and in such unacceptable ways that my own experience is completely denied, completely. So I think that if in the future, or Western medicine as it maybe I'm being an optimist, but maybe has the humility to start realizing that human beings need to be treated respectfully, and human beings need, if you're going to become a consultant, a nurse, whatever it is, you need to remember your humanity first.
Yeah.
And people like you and I know our bodies really well. I mean, the amount of times I've been told there's nothing wrong, and then within kind of a nanosecond, I'm in a full-blown emergency. And I've had to learn, as you have, to stay equal, not to go down, not go up, with actually everyone else's stuff. I just have to the best of my ability, stay equal. So
I think the worst bit about that experience is the fact that sometimes, like when this woman originally, the first time I saw her, I'd had the MRI which showed I had a herniated disc, and I went to her, and bearing in mind I was 20 odd stone, and I'd come off steroids and I was slowly losing the weight. But for her to say, well, I can't see anything wrong with your disc, you're fat, lose weight. Now, I went away from that appointment in absolute tears, but angry as well. But I believed her, so I went and did all of this walking for miles and, like, you know, I've got to lose weight, I've got to lose weight. And within literally months, I'm rushed in and operated on because my disc had herniated, ruptured into my spinal cord, and I couldn't move. I was getting, honestly, it felt like someone was trying to saw off my ankle. And the cramp, like when people get cramp and, you know, they walk about and having that cramp for 2 days at home, where every time I slightly moved in the bed, it would spasm to the point where I was sobbing because it felt like someone was trying to rip my ankle off. And it took the ambulance and firemen a couple of canisters of gas and air just to get me down the stairs into the ambulance. And being rushed in and being like, oh, we need to operate, you know, when she'd told me there was nothing wrong a few months earlier. And it's like, I believe them because they're meant to, you know, they're meant to know their stuff. They're why you go and see them.
Yeah. I mean, Alison, I'm sure you hear this also. Almost half a day doesn't go by without me hearing all of these stories all of the time.
Yeah.
And every single human being behind the story is trying to come to terms with what they have, all the hopes, dreams, and expectations that have been shattered, and the consequences of not being treated in a humane way. And that's a lot. So you then add what I've got a particular bugbear about. You add what I call spiritual. I've got to think of a polite word for it. Spiritual, well, I'll just say spiritual positivity on it, you know, and it's a load. It's a load. So there's so much out there that actually doesn't give us a humane helping hand. And that's what I'm attempting, God bless me, my stupidity, really. I'm attempting to build, because there's a lot out there, but it doesn't genuinely actually support us where we need to be supported.
No, it doesn't. And I think Matthew's mum is a prime example, my husband's mum. she's been diagnosed with idiopathic pulmonary fibrosis. So she's got lung scarring. And it's severe enough now that she can't catch her breath. She can't, she's very poorly. But she's been programmed to say, there are worse people off than me.
Yeah.
Oh, there are people with cancer. Yes, there may be people out there with cancer, but that, not always, but 9 times out of 10, if it's caught early enough, can be cured. You have scarring of your lungs. They're not seeing you. They're not helping you. And we're made to believe that having a chronic illness or disability is less than someone with cancer. Well, yes, I understand someone's got cancer. Matthew's twin brother got bowel cancer just in lockdown, and they caught it early enough, and he's been given the all clear, and he can carry on about his life. When you've got something like Ehlers-Danlos syndrome, degenerative disc disease, ulcerative colitis, diabetes, asthma, it doesn't go away.
No.
You've got to live with that.
Get a day off.
Yeah, you don't get a day off. I woke up this morning and the pain in my shoulder and arm was so intense, but also my fingers, my 2 middle fingers, were completely numb, but it was that radiating painful numb, where obviously the pain with everything, with the three, because I've got the C4, C5, 6 and 7 discs gone in my cervical area, that obviously it had impinged a nerve again, but it was absolutely excruciatingly painful this morning. And you do have to live with it every single day. And you don't get a break. No, you're right.
No. And, one of the, I try to say light-hearted, but it isn't light-hearted, because I work with a lot of people with cancer also, and this is the kind of subject that you're not allowed to actually say out loud, but I'm always saying things out loud that I probably shouldn't say. But actually, if you've got, I've had in my, so far in my life, had 3 different cancer diagnoses. Now, the only time I get attention immediately, efficiently, straightforwardly is if the word cancer comes in.
Yeah.
So, if you have heart disease in this country and if you have a cancer, there is a whole, and nothing I say is supposed to be insulting to anyone who has got the unfortunate situation of having cancer. But actually, for people who don't have heart disease or don't have cancer, or heart disease and cancer is part of the package, there is nothing in the way of real support.
No.
All these chronic conditions. And the thing that is scaring me is that these chronic conditions are going up, not down.
They are. Yeah, they are. I watched my mum die of bowel cancer 2 years ago. She was diagnosed and gone 6 weeks later. It's horrific. And her problem was because, and again, probably explains a lot of my childhood, she didn't discuss bodily functions. She grew up in a Catholic convent boarding school. It wasn't talked about, it wasn't discussed. It was a very taboo subject. So she left it to the point where she was riddled with cancer. And it's a horrible thing to have. And I've seen loved ones die, and I've seen loved ones with it and get through it. Yes, cancer is absolutely horrible. But again, not downplaying it in any way, shape or form, but it can be curable. Yeah.
And there are numerous supports.
Yeah.
Financially, nurse-wise. But when you have, like you have, Alison, really seriously agonizing conditions that are multifaceted, you don't even have somebody regularly checking in on you emotionally, physically, medically, spiritually.
Yeah.
So, and you're our shoulders, our necks, or whatever, metaphysically, but in reality, we're carrying so much, and it's too much. It is,
and you don't, support in the workplace when you've got cancer is also, you know, quite a big thing.
Yeah.
But for us that end up with chronic conditions where we have to leave our jobs and live on disability living allowance or PIP of £300 to £400 a month, depending on whether you've got a Motability car or not, is an absolute mickey take.
It is. It is.
You know, you're disabled, you physically can't work anymore in what you call a normal job. But that's okay, you don't need money to live on. You can just manage with buttons. And, you know, just because we're disabled doesn't mean to say I got frustrated that I couldn't work when I stopped working. It was awful. I was, you know, having ADHD and sitting around doing nothing all day was driving me bananas. And to be expected not only to not work because the jobs you used to do you can no longer do, but for then to be told, well, the lifestyle you had, and which is why a lot of disabled people are in debt, the lifestyle you had before you got ill, you had a full-time income, you could afford that. All of a sudden you have a disability or something comes along and puts you on your ass. They're not going to give you any money for it other than the bare minimum, and you're expected to, you know, maintain the lifestyle you had, which you can't because the financial help isn't there. So you get in debt and it just spirals you further down into depression. And as you said, there's no emotional support, nothing. You are just expected to get on with it. I spoke to my GP yesterday. It's a new one because we've just changed surgeries. And as much as she was, you know, helpful and she was trying her best, you do feel like that, as I was saying the other day, it's kind of like you have rights as a human being, but when you get a chronic illness or a disability, that all goes out the window and you're treated like the lowest of the low.
Yeah. Yeah.
And there's just not enough people out there fighting for it. I know there is a big movement on TikTok at the minute for autism, a big movement for children that have got autism, especially non-verbal. And, you know, getting the help and support from the government. They've done a load of, you know, big protests and everything else, which, don't get me wrong, is absolutely amazing. Having a son and daughter with autism, you know, I take my hat off to them. They're doing an amazing work compared to what I was dealing with 30 years ago. But there should be more support and there should be more help for people living with chronic illness and disability.
Yeah. And I think also, I mean, this is a really big subject, but I do not understand why anyone that is in a position of power is not actually getting at the roots of the problem.
Yeah.
So, you know, the way that I see my job and what I'm building is to give people a series of opportunities that are manageable to make a difference mentally, physically, and spiritually. Because, you know, now that I've really seen the problem, I just couldn't stand by. I wanted to be part of what is the solution. So, you know, the more that we can, because you're I don't know you very well at all, but you're an incredibly gutsy, straightforward woman, and you're highly articulate and intelligent. And thank goodness you don't come across as, you know, somebody who's just kind of lain down, which would be understandable, and just gone mow me over. You know, you've got an absolutely loving partner, and you're extraordinary. And that has to somehow get across, because there's a stigma about disability and chronic illness where actually corporations or businesses that are in the position to change this, they need to change how they view us. You know, just because I've got lipstick and my hair is clean today doesn't mean to say I'm any less disabled than when I don't have lipstick. Do you know what I mean? But, you know, you and I are in the actual minority because we can stick up for ourselves. But I meet people day in, day out who've gone down the tubes and they're longing for somebody to say you're still of value. So the thing that really...
That is why I wanted to... that is definitely one of the, which is why my thing with hope was, you know, it just, it doesn't have to be the end just because you have a disability, you're diagnosed with an illness or a disability, or your child's diagnosed with an illness or disability. It doesn't mean to say that's the end of the world, you know.
No,
Yes, perspective may change. Yes, your lifestyle might have to change, but it doesn't mean it's the end of everything, you know, and you've got to give in and sit there and say, why me? Or, you know, this is the end of everything now, I've got no life. That's not true.
no. And I think also when outside factors are dictating to you, if they're loud enough, it's easy to get bullied. You know, and bullying is something that I think in the Western world and well, in the whole world is something that is a really big factor. And
Yeah,
even in the name of health, or even in the name of spiritual truths, that it's just straightforward bullying. So
it is. Yeah,
if the world is dictating to you that you can only live on £1,000 a month or whatever it is, and that your lifestyle has to change, actually what happens to people is you sort of start cowering and you start feeling punished and ashamed, which actually is very understandable. Not that you have anything to be ashamed about, but if the world treats you as if suddenly you're a second-class citizen, you start feeling like it. Your shoulders kind of go down and you're cowering. But actually, all it takes is for someone like yourself or me to come along and go, hold on a second, this is what you have right now, but there are other ways of earning a living, and there are other ways of you beginning to engage again with your value. Then immediately this overwhelming sense just comes back up, which is what
yeah.
we all need. Do you know what I mean? I know that if I have a lousy day, I could text you and I could go, Alison, I'm going down the tubes. Can you just give me a little word of encouragement? You wouldn't try to fix me. You wouldn't give me some spiritual nonsense. You wouldn't try and be positive with me. You know what I mean? You'd go, well, blimey, is that all you're feeling? Do you know what I mean? And that's all. We'd laugh and we'd get up again. That's what we need. And we need to get those simple solutions, not fixes, out. People
Yeah,
need to understand.
and I
You know,
think perception needs to change as well, because, so for instance, I've been, and I asked this question a couple of times, I've done a couple of polls on it. When you see someone in a wheelchair, out and about in a wheelchair, not a mobility scooter, because let's be honest, most people on a mobility scooter can still walk around. They just use the mobility scooter to get to a shop, whatever, pretty much like a bike. But if you see someone in a wheelchair, what is your automatic thoughts? They're on benefits, they can't work, they're broken. Now, I asked someone what they saw when they saw me in a wheelchair, and they were like, well, you're overweight, so you probably, you know, you can't walk because you get out of breath. No, that's not it at all. I'm overweight because I've been on steroids for 14 years, and I went from a size 6 of 8 stone up to 28 stone and 22 stone in a size 28. And unfortunately, once you've taken steroids for as long as I have, there is no going back from it. Yes, I've lost, I think it was about, I think I lost something about like 7 or 8 stone coming off the steroids, but it's still there and it will never go away because I can't now exercise because the steroids have ruined my bones and the mental health issues it gave me, the diabetes it gave me. But your perception of me is, oh, you're fat and you're in a wheelchair, so it must be because you can't be bothered to walk because, you know, you're overweight. No, no, not even close. Thanks anyway. And that's the perception of people. And you know, I started seeing people in a different light because I can, hand on heart, when I was a teenager, saw people in a wheelchair and thought, oh, well, they'll never work again. They must be really broken. That's not true. I am an author. I'm a coach. I'm a social media manager. You know,
yeah,
just because,
yeah.
yeah, you know, and I think that
Just
perception
because you've
definitely
got the guts, and because you're not your disability, you're not the
yeah,
pain you live in.
yeah,
You're not overweight. Do you know what I mean? In your spirit and in your personality, you're this very, very highly functioning, incredible, capable, beautiful woman.
thank you.
Well, it's true though. But you know, we're not treated like that.
No, we're not. No, definitely not. As I
So
said, you know, we're looked down on, and it just, something needs to change. There needs to be a shift.
yeah, yeah. Well, we're doing it
We are indeed.
now. Alison, if there was any question remotely that you'd like to ask me, I mean, I can't think what you might like to ask me, but you could ask me, and we could always do another one of these, because it's really important that we just keep getting the word out there. Because, you know, I'm going to say, if anybody listens to this, please, will you start changing your perception of disability, please? And start talking about it. Start talking about it around your functional families. You know, get people to start talking about their perception of what does it look like when someone's overweight or has a wheelchair or a walking stick or anything. What does it mean to you?
Yeah.
Now, before I carry on ranting, I shall be quiet. Alison, what's your question?
I guess really is just kind of how you ended up here. You know, obviously you, as you've said, you've got, I know about the Ehlers-Danlos syndrome, and it's just what made you decide this was what you wanted to advocate for and fight for. What was your turning point of saying, actually, no, I'm going to stand up and fight for people?
Very, very, I mean, lovely question. I think, I mean, Alison, I will never, ever understand or know how I managed to qualify in anything, frankly. But when I did, and I suddenly discovered I was good at something. And I had, I mean, on and off, I've had 40 years of clinical experience, and I absolutely adored it. And it was a very, very physical job.
Yeah.
So I mean, my entire life and so-called career has been like snakes and ladders. You know, you sort of go up a ladder, and then suddenly you're, you know, winning the game, and then suddenly you get the snake and you're all the way down. And the reason why I call my life like snakes and ladders is that I would sort of have clinics open, and I would be working with patients. On the whole, I was iller than any of them, which was always very funny. And then I would have these sudden emergencies. And about 15 years ago, I ended up being properly diagnosed. And I had 13 consultants that were, I thought they would communicate with each other, but that's not what happens generally now or ever. And they all started putting my entire story of my life in some kind of order. And they even realized my mother had had Ehlers-Danlos and my grandmother. And then they decided that I had a sort of slightly more complicated Ehlers-Danlos than the other Ehlers-Danloses. And as soon as I got my head around that, I think they've now changed the criteria. So frankly, I've just lost the plot completely. And then I had to have this long-winded answer, but I had to have, so each of the surgeries that I've had on the whole have taken about 3 years for my body to sort of recover from. And I suddenly had to have 5 massive surgeries and sort of be rebuilt from the neck down. And I realized that I would never, ever be able to go back into clinical practice. And I really, having negotiated 40 years worth of snakes and ladders, I just fell off the board. That's the only way I can put it. And I went to below ground zero on every single level. And I had a conversation with my pension provider. I don't think the answer is going to go in the way that you think it's going to go. So I had a conversation with my pension provider, and this very serious man said, he basically was saying, in very polite English language, he was basically saying that he didn't think that I was quite ill enough to have the £7,000 that was in my pension. And £7,000 15 years ago would have been quite, something would have got me through whatever.
Yeah.
And in the same breath, he said, so we are not dying, so we can't give it to you. Okay. And I went through the yes, but he wasn't interested. And then he said, however, what I would like to know is, how would you like your yearly sum of your pension to come to you? And I said, so let's just get this absolutely clear. I'm entitled to £35 a year. £35. And I think it was 62 pence. Okay. And you are asking me how I would like it delivered. And I am apparently allowed to have that divided into 12 months.
Wow.
Now, I got off that phone call and I thought, this conversation sums up the utter madness that I've been in all my life. And I made the mistake of thinking it was me for a long time. And I now realize it isn't. When you fall down the cracks or you're at ground zero, there is no help anywhere, really. And then I was living in my own little tiny flat. I knew where I was. I'd been able to just about afford things. I always was paying back the last surgeries, blah, 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 blah. And I remember ringing up the disability people or whoever it was, and I was shaking with shock and fear and utter bewilderment. And I said, what actually is available if you can't work any longer and you've been self-employed all your life and your pension isn't big enough? And you're looking forward to 5 more surgeries? And they said, oh, well, we can offer you a bed sit in Hastings or somewhere. And I put down the phone again and I just thought, hold on, stop, Catherine, don't you dare go down this vicious cycle now.
And it's so easy to, isn't it?
Yeah. And I thought, you know what, you've got 40 years of clinical experience, and far more importantly, you're whatever age I was then, you've got all these years from almost before you were born of really rich experience. And you are the one that has survived. Then it was 36 surgeries, I think, 3 cancers and 1 stroke. I've now had another stroke. And I just thought, you know what? Good. Okay, great. I'm going to gather all this up and I'm going to see if I can make it useful to other people, because this is nonsense. No human being should actually be treated like I am being treated, and how inevitably I'm feeling.
Yeah.
But it was the things that you would think would be out there for you. I literally fell through every single crack that there was out there. And because I've got a posh voice, people made ridiculous assumptions about me. And I've got pieces of jewelry that this is the first piece of jewelry I ever bought myself, with the first £100 that I ever had spare in my life. Do you know what I mean? It's like, don't make assumptions.
No.
Every penny that I've ever earned has gone into staying alive. And there never, ever, ever was any spare. And suddenly you're given a diagnosis and you go.
Mm-hmm.
And now, really happily, I'm building this slowly, step by step. I haven't had any investment or support or funding at all, except from a couple of really amazing individual friends who have believed in me. And I'm still going. Most companies, they close within, apparently statistically, God knows whatever it is, you know, and we're still rocking and rolling. We're now making it much easier, but we've helped so many people. And people who come to me, Alison, and they can't afford to spend time with me, I say yes anyway. That's how we all ought to behave.
I was going to say that's kind of one of the main things that was kind of my main worry, I think, was helping parents with children with autism, and knowing that being in that situation myself, not being able to work because I had 3 very poorly children, was like trying to afford anything when you're living on the breadline because you can't work because you're at home looking after children that are sick. And knowing that's how a lot of parents are at the minute, and knowing that anything that I could do to help them. So all the benefit advice I put on my TikTok videos, the Iceland food card that went completely insanely viral. To me, that was just helping a fellow parent because I've been there.
Yeah.
And so I got told I'm the Martin Lewis of disability, because
wonderful.
because you know it's every day I scour the internet, the news, everything, to see what is coming up, what is happening, what, you know, if there's anything that I can offer to people that might help them in their journey, in their life, with their children, with their disability. So the things like the Iceland food card, knowing about the child trust fund that a lot of people had completely forgotten about because they stopped it years ago. Any bit of advice I can get that can help them with the Motability car, getting the extra paint. They were giving £750 out this year and last year to anybody that took on a Motability car, because they weren't having people join the scheme, because in lockdown nobody was using their cars, because they weren't allowed out. So they all of a sudden had a massive drop in people getting a Motability car. So they were like, right, if you get a Motability car now, we'll give you £750 cash.
Alison, you're a star. You are a star. Yeah,
it's
well,
who we are, isn't it? It's our nature to help those who've been either in the situation we were in or are in, or anything we can do really that's going to make life that bit more bearable when you're suffering, or you've got children suffering with disability and illness.
Yeah, I mean, I think I hope that we talk a lot more in the future, but I'd like to sort of end this session with Christopher Reeves. I don't know whether you know this, but when he had his accident, he said a really lovely thing, and I'm probably going to misquote him, but you'll get the essence of it. He said that the people that he felt really sorry for after his accident, he put it something like this. He said, the able-bodied people that are disabled in their minds, I really feel compassion for them, because those of us that are disabled, we are not disabled in our minds or our hearts.
No, that's very, very true.
You know, somebody once said to me, they said, how can you afford, when your finances are in such a mess, how can you afford to give of your skills? You know, it's not respectful of you. It's not respectful of them. And I said, it's respectful to our humanity. And if you don't understand that, if you've been as low as you and I have been, you will do anything to give a hand up to someone, because you know they won't take it for granted. They will not take the piss. Of course, there are a very, very, very small minority of people that are so sick in all sorts of levels that they will take the piss, but that's their problem. It's not your problem. It's not mine.
Love it. 100%.
It's lovely talking to you, and please let's do this again.
Yeah, of course. Yeah, that would be amazing.
And lovely to have met you.
And you, finally.
Bye-bye.
Take care.